I know he is. Right, so we are now going to have a fairly orderly question and answer session. And as I said in my assertive beginning to this, we'd like questions. A lot of us know how long you've had ME for. Let's just try and keep it as questions and giving Dr. Shepherd a chance to answer. We have here a list of questions that the group sent in on request, so we hope to get through some of those. I'm going to ask Sohail to kick us off because he has a question.
Yes.
And when you ask a question, can you make sure everybody hears the question?
Someone's actually just given me this leaflet now, so it probably
So
answers
you know the answer to it now?
Well, I haven't read it yet, but basically, what was your opinion on the flu vaccine?
It's a good question, and I brought a leaflet on it. There's still a few of those left. You can download this leaflet free from the MEA website. It says 2019-220 flu vaccines leaflet. Should I have a flu vaccine? There isn't what I would call a simple yes-no answer to it, because first of all, as probably people are aware, some people with ME/CFS, probably because of this immune system activation that goes on within the illness, do react rather badly to vaccinations in general. So, in other words, because a vaccination mimics the effect of an infection on your immune system, it does, or has the potential to stir up the immune system a bit, which is why many perfectly healthy people feel a bit off colour, may get a temperature, may feel muscle aches and whatever when they've had a vaccination. So some people do react sometimes quite badly to vaccination. So I'm not in any way anti-vaccination, but if you are going to have a vaccination, don't have it when you're going through a particularly flu-like period of your illness. And there do seem to be some vaccinations, hepatitis B in particular, which seem to cause more problems for people with ME/CFS than other vaccines. When it comes to flu vaccine, anecdotally over the years, we've repeatedly heard from people, lots and lots of people who've had a flu vaccine, who've had no problems with it whatsoever. However, we've also had reports from people who've been knocked off, sometimes quite considerably, by having a flu vaccine. And there are even reports in the medical journals of two cases, and it's in this leaflet, which you can download free from the website, where this was swine flu, similar sort of vaccine, where people actually had a very severe reaction and got reported in the BMJ. So there's not a simple yes-no answer to it. We did a website survey on this, and again, most people I think from that survey didn't have any problem, but again, there was a significant minority who had more side effects than you would expect, and a few people who had a nasty adverse reaction. And there's no way you can predict this, apart from perhaps if you've had the vaccination in the past, you've had problems, or you've had flu vaccine in the past. So what you've got to do really is weigh up the pros and cons, and I've summarised the pros and cons in that leaflet. I mean, obviously if you've got any other disease, if you've got a chest disease, a heart disease, lung disease, kidney disease or whatever, where flu is going to cause a real problem for you, then that's a very strong indicator that you ought to seriously consider having it. A nasty dose of flu is probably going to knock your ME off quite considerably. So, you know, there's pros and cons to it. So you've just got to weigh up these pros and cons and make an individual decision. Personally, I don't have a flu vaccine. When I went to see my son in India a few years ago, last time I had a pincushion full of vaccinations. I had the lot apart from hepatitis B, because it would be stupid to go to India and not have protection against hepatitis A, typhoid and everything else that goes with it. So it is pros and cons, but as I say, some people do, some people don't, and I've tried to summarise everything in that leaflet.
It's a vaccine-related question. My ears picked up when you said in your presentation that we know it starts with an infection, triggers our immune system responds.
Mm.
In this document here, and I've read it elsewhere, it says that some sort of viral infection is the most common precipitating factor.
Yes.
But sometimes it can be from vaccinations.
A vaccination, yes.
And from pesticide exposure. So it's
Yes.
quite important for us to know if what you said earlier is actually the fact that it's always an infection that starts.
MECFS, in most cases, people will predate it to an acute infection. But, and I would say, personal experience, that's probably around about 75% of people. There's about 25% who don't have a clear acute triggering infection. Sometimes there's really no clear onset to it at all, and that's another sort of red flag for really investigating someone much more closely as to whether they really have got MECFS. But in my experience and anyone else's, there are undoubtedly people who do start this illness without this nice classic post-infectious start to it. There are this small number of people who are clearly perfectly well, and then they start it following the infection, as I say, a vaccination, because an immunisation vaccination is just mimicking the effect of that infection on your immune system in order to make you produce antibodies to that particular infection. So it's a similar sort of immune system stressor mechanism that's going on. And are you quoting out of my purple book or some other document?
Yeah.
There's a thing called the Chief Medical Officer's Report on MECFS, which came out about 2002, which I helped to write as well. And we actually put into that document the fact that vaccinations can sometimes trigger this. So I think it is generally accepted that vaccinations can trigger this illness. And as like infections, they are a trigger factor. They can be an exacerbating factor to a pre-existing disease. But I think it is important to make the point, I am not in any way anti-vaccination. I hesitate. I spent quite a lot of time in the garden, and I hesitated, actually decided not to, but it was quite a difficult decision as to whether to keep my tetanus booster up to date. But knowing some of the patients I've seen who've had a quite nasty relapse with a tetanus booster, I decided not to.
I think just what is important for us is it also says sometimes the stressful life events can be the other trigger.
Yes.
Is that if we're looking for research and for finding out why this awful thing's happened and how we're going to improve, that actually we don't really know because there are all these different factors.
Yes, but I think all these sort of actual specific factors that are generally accepted as being trigger factors in addition to an infection, they all are some form of, in jargon, immune system stressor. They're all putting quite a lot of stress on the immune system. So you will get, and this is particularly more so in this overlapping condition, fibromyalgia. A lot of people will start their fibromyalgia following a road traffic accident, and there are certainly people who certainly get a relapse or exacerbation of their MECFS symptoms if they have a road traffic accident, and there are some people who start their MECFS following an RTA. Some people start following pregnancy. That's another trigger in a small number of cases. And I mean, the other immune system trigger that sometimes comes in is surgical operations, major surgical operations.
Okay.
Yeah, let's move on to another one.
Can I just have a show of hands from people who want to ask a question? I'll make sure I get round you all. Sarah, because you're next.
You said that the Acumen test for mitochondrial function is not valid. Is it
Well,
just the test that's not valid, or is it specifically about the mitochondrial that's irrelevant? Is mitochondria relevant?
Oh, well, the mitochondria is certainly very relevant. The mitochondria, for people who are not fully up to speed with what mitochondria are rather like Duracell batteries within your muscle. But they're not only within your muscle, they're within every cell in the body, and they're basically where energy is produced. And we know from a number of studies, and strangely enough, because I brought it back from the office because I dug out the paper while I was there because I'd lost it, on the 23rd of June 1984 in the Lancet, this was 2 or 3 years after I went down with this wretched illness. I was working with Professor George Rader at the University of Oxford, and George Rader was a big neuroimaging expert, and we did some neuroimaging studies on the way my muscles produced energy. And my muscles, like other people's muscles, when they exercise them, produce an early and an excessive amount of lactic acid. And that links in with the other work on the mitochondria, because at the same time I was having chunks of my muscle and mitochondria looked at under the electron microscope at the University of Glasgow with Professor M.E. Beard. We also published those findings, in which there were structural abnormalities to these Duracell batteries, these mitochondria. So mitochondrial dysfunction is, I think, definitely part of this disease. We fund a chap called Professor Carl Norton at Oxford, who did actually the Acumen test retesting. He is a mitochondrial expert of world renown, and he's doing quite a lot of research that we are funding on mitochondrial dysfunction, as is Julia Newton up in Newcastle. So mitochondrial function is, I think, a key part of this illness. But the Acumen test was developed by these people, and it is supposed to measure what's called ATP, which is one of the products of energy metabolism. And we it was never accepted by muscle experts as a valid test, and there was always this big question mark on it. And when the people at Oxford and Newcastle compared it to what were really gold standard tests of mitochondrial function, it didn't come up to scratch. So I personally, my view from the test, the validation study, is that the Acumen test is not an accurate
But
measure.
are there other tests that can
There
test
are,
it?
but they're not. They're either research orientated or they're not really valid for use in clinical practice for assessment of people with ME/CFS at the moment. You can take muscle biopsies and look at them under the microscope. You do this neuroimaging, but it's not something you can do at the moment in the way of normal clinical assessment.
Maxine,
Going back to your other point.
can you make sure they're here at the back, Darling, please?
Yeah, because there's possible infections and virals that can trigger it. Is there anything in actually, like, do you think that they maintain at a low level so that it's that continues that state of fatigue and everything, and therefore is treating with antibiotics and antivirals? Do you think it would make any difference?
Well, as I said at one point during the slides, the evidence for the virus that starts the illness off persisting, like it does in AIDS with HIV or hepatitis C, hepatitis C infection, that's a nasty infection that persists on. The evidence for that, and these studies have been done quite exhaustively, looking at evidence for persisting enteroviral infection and poliovirus type things, has never really produced any evidence of persisting viral infection in relation to the virus that set it off. But as I've sort of sidetracked onto, there is this evidence, if you want to follow it up, it's in the purple book, the papers are all there. It's not consistent, but there is some evidence there that these viruses, like Epstein-Barr virus that causes glandular fever, and once you've had glandular fever, that Epstein-Barr virus does linger on in the body, not normally causing any problems, but it lingers on. And herpes viruses, human herpes virus type 6 and type 8, these are the viruses that cause cold sores and things like that. And they periodically reactivate in perfectly normal human beings. But if you look at the bloods of people with ME/CFS and look for evidence using antibody tests and things for reactivation of the Epstein-Barr and the herpes viruses, there is some evidence that these viruses do go up and down and do become reactivated. And of course, if you've got reactivated viral infection like that, that may be contributing to periods when you feel a lot very sort of flu-like and glandular and everything else like that. And the work that, Jose Montoya, this American physician that treats people with this antiviral drug called valganciclovir, and has published some small clinical trials on this. He takes a very selective group of people who have a lot of ongoing infective flu-like symptoms, so they have a lot of glands and sore throats, in combination with blood evidence of reactivation of Epstein-Barr and herpes viruses, and he gives that particular subgroup valganciclovir and Valsite, and claims that it works in some of those patients. And it's something which deserves a more thorough clinical trial, which hasn't sadly happened.
Question? You have?
Yes, I'm interested in finding out about the vitamins, that especially vitamin B12 injections and vitamin D3. I mean, it might be on your list.
Strangely enough, it's one of the questions down here. Maybe it's not your question here, but there is a question about vitamin B12, certainly.
And why it sort of does help some sufferers and not others, is there?
Well, there's three sort of quick components there. First of all, vitamins in general. There is no evidence for studies that we've looked at so far which have either looked for specific vitamin deficiencies or treatment with vitamins that has shown that there is either significant vitamin deficiency or response to specific vitamin treatments in ME/CFS. So from that point of view, there is no particular point in taking vitamins, multivitamins, etc., etc. Now, you mentioned two specific vitamins which are quite interesting. First of all is vitamin D, which is the sunshine vitamin, which prevents you from getting osteoporosis and everything else like that, bone problems, whatever. And there is now a move. Well, first of all, there's I think probably best described as accumulating evidence. It's not firm evidence, but there is evidence suggesting that deficiency of vitamin D may contribute to a number of conditions, things like multiple sclerosis it's been linked to. So, in addition to the bone problems of having low vitamin D levels, that is something that needs to be taken into account. And there is one study, it's in the Purple Book, which has looked at vitamin D levels in people with ME/CFS, particularly the more severe end of the spectrum, and found lowered levels of vitamin D, which is hardly surprising if you've got severe ME/CFS and you're bedbound, housebound, you're not getting out in sunshine, then you're not getting vitamin D. So I think there is a strong case, I haven't brought one with me, but we've got a leaflet on vitamin D as well. There is a strong case, I take a daily vitamin D supplement now, I think there's a strong case for possibly the whole population almost taking a low level vitamin D supplement.
I heard it might help with the balance issues.
I don't think it will help with the balanced issues, but at a more severe level of vitamin D deficiency, it can cause muscle pain, hip muscle weakness in particular. It doesn't just affect the bones. So I think vitamin D is something that certainly at the severe end of the spectrum with people who are not getting out in the sunshine, it may be worth actually having your vitamin D levels checked, because you may need a rather more aggressive form of supplementation. But I think there's a good case, certainly for people who are not getting out and about very much in sunlight and absorbing this very important vitamin, and for taking a vitamin D supplement. So that's the only supplement that I personally think that people with ME/CFS need to be considering taking. But the third one is the vitamin B12, which we know people doing this take. We've got a leaflet, I haven't got that many here, but I've done a leaflet on evidence in relation to vitamin B12. Again, I have to say there's no evidence from scientific studies of vitamin B12 deficiency, or any real evidence. There are some very small clinical trials, but they're not very good, of any benefit from vitamin B12 injections. There are dangers of having vitamin B12 if you haven't been properly checked to make sure you haven't got something which is called pernicious anemia, which is serious deficiency of vitamin B12, because this is a problem where you don't absorb vitamin B12 from the stomach. You've lost the ability to do that, so you have to have vitamin B12 injections. And if you start giving people vitamin B12 at a low inappropriate dose who've actually got pernicious anemia, which can cause ME/CFS-like symptoms, you are risking something really serious which is called subacute combined degeneration of the spinal cord, which is degeneration of the nervous tissue in the spine, and that's what vitamin B12 deficiency leads to. So you've got to be very careful about just going off and taking vitamin B12 or having injections if, you know, PA, pernicious anemia, hasn't been excluded. And it's in our leaflet, the doctors, because it's quite a common question we get, why won't my doctor prescribe vitamin B12 injections? You see, it can't do any harm, and I've heard that it can, you know, some people say it makes them better, blah, blah, blah. And doctors are very reluctant to prescribe vitamin B12 injections for these reasons. And as doctors, if we do this sort of thing and prescribe potentially, if we do things which could be dangerous in our prescribing habits, as could happen here, you could end up before the General Medical Council. And there is one doctor, and it's referenced there in our leaflet, who actually had to go before the General Medical Council for prescribing what they felt was inappropriate B12 injections to people who had no B12 deficiency. So the bottom line there is that you're probably unlikely to persuade your doctor to prescribe B12 without sufficient evidence of deficiency, and it's not there at the moment.
Thank you. Question here?
Yeah.
Hi. I just wanted to, sorry, I'm getting hot now. Just wanted to tag onto the back of that. So I take quite a number of supplements as recommended by Dr. Sarah Myhill. And I would say the main one that really helps with reproduction of energy is DBOs. I've also tagged onto that, not as recommended by her, but creatine, and I find that the two together really, really help. The problem that I've got at the moment is I'm in a lot of pain with sciatica, and as I understand it, you shouldn't take creatine when you're taking naproxen, but the GP is not able to advise that.
Right, I would have to quickly go and look that up, because I won't give you an answer without quickly looking that up. It does ring a slight bell, but it's not something I've been asked for several years, and I wouldn't give you a definitive answer off the top of my head without looking it up. We do actually have in our sort of extensive list of 70 leaflets covering everything under the sun, and we've got one that covers all these, well, I have to say they're so-called muscle energy supplements. Creatinine is quite a popular one. Ribose is another one. I mean, I have to say they're not things that I either recommend or prescribe or say people ought to have, because the evidence base for them is basically nil. But if you find something like that is you can afford it, it's not causing you any harm, and you believe in it, then you know. I'm not going to criticise it.
At the moment, I'm just fighting between having that energy and getting rid of the pain. So
yes. There certainly are supplements which things like naproxen can interact with. I would suggest just checking that on Google.
I have. It's that there's risk of bleed problems.
Yes.
Yeah.
So is
actually just thinking it through? Yes, you're probably right. Yeah, I would. If it is there, I would not take the two together.
Okay.
Yeah.
So your ME Association website has that particular leaflet.
If you go to our website, and you may find that the website's about to change because we're revamping the website over the next few days, so there's going to be a totally new website. But on the website, either the current one or the new one, there is what's called a website shop, and it has got a literature order form, and you can either download leaflets, some of them are free, some of them cost £1, or you can order them by post from the office if you want as well. But it's got all 70 of leaflets, which I think there's hardly anything that we don't want to cover now.
Hello. What are your views and experiences with CBD oils or preparations? They seem to be the buzzword, and lots of people say they help, some don't. I know they're varying levels of. I know they come under a food rather than a medicine.
Yes,
so they're not really tested very
there was. I've been away, so I haven't actually had time to read it thoroughly. But I know it was on the news the other day there's been some further relaxation in the prescribing of these things, because there is some sound therapy, clinical evidence from research studies that these things do have therapeutic effects. And there will be interesting studies in relation to drug-resistant epilepsy, where it's now being licensed in certain situations. And there certainly seems to be some evidence that these things can help with pain. I have no personal experience of using these CBD oils. There is no evidence from the research point of view of clinical trials in relation to ME/CFS. But having said that, we have a very active Facebook page where these sort of things get discussed. This sort of thing comes up once a month probably. And when it comes up as a subject, there's always about 60, 70 people who will respond. And I have to say, the majority of people who respond who are using these oils, the response is fairly positive. So I think it's something that's worthy of further research in this area. I think there may be some genuine therapeutic benefit for pain relief. So I wouldn't dissuade anyone against it, but all I'm saying is the evidence for both effectiveness and safety is not there at the moment. No. So you do it with caution.
I know,
yes.
I just want to add that I raised it with my own GP because I know that if you take CBD, it can affect one of your liver enzymes. So it can affect how your other medications are being metabolized. So your other medications can go up without you realizing.
Yes.
So you should always tell your doctor if you're going to take it. You should always tell your doctor.
Yeah. No, I think that's. Thank you for raising that point. That is an important point.
Was that the end of your question?
Just thank you. The Witch magazine was quite scathing about some of the CBD products, and they've done a lot of tests on them.
Right, I haven't read their report. No, of course, I mean, the problem is that these things are just being overhyped. Now. I live out in the Cotswolds, and I know in Cirencester of all places now that there is a shop just selling these products. And I'm not saying that this is not material from this shop, but I mean I have seen people sending it to me now because there's people making a lot of money out of this. There are people advertising these things, and they are making. I think they're unaware of something called the 1968 Medicines Act, which prevents you from doing this. They are making unsubstantiated therapeutic claims in their advertising material about this.
That's basically what they said to be aware of in the Witch magazine. That different ones have different amounts of CBD oil in different strengths and different things, and to be very careful when you buy them from a really reputable.
But I think it's something that's worthy of a clinical trial.
Okay. Thank you.
Hi, I just wanted to ask if you had any advice on MCS for the MCS, multiple chemical sensitivity.
Oh, well, sorry, I'm with you.
Yes. So for the first 20 years, I've had ME for about 35 years, but for the first 20 years, I could tolerate most things. But for about the last 15 years, it's got really bad, and it just seems to be getting progressively worse.
Yes.
So I just wondered, did you have any?
I don't have, unfortunately, much to add to what you probably already know.
Right, okay.
I mean, what I will say is that there is a certain degree of evidence which suggests that there is an allergic component to this illness. So there is some sound research indicating that some people are more prone to develop allergies, and that probably ties in with the immune dysfunction. I mean, interestingly enough, I mean, it may be pure coincidence, but one thing that happened to me after developing ME/CFS was I developed hay fever. I'd never had hay fever before, so it's not unusual to hear this sort of story. But I mean, obviously, what you're describing, multiple chemical sensitivity, is a much more widespread allergic type.
It's like sprays and
response.
Perfumes and sprays.
It's not, as you know, something that is dealt with very well by the medical profession. There aren't many doctors that provide good sound advice on it. I mean, clearly when it's, I don't know whether you want to tell us, I mean, do you have any specific treatment for it? I mean...
Not really, it's
No.
just, no, I mean,
No.
I've been told to take the antihistamines, but that
Right,
doesn't
okay,
really
you've
work.
never gone down any
Yeah.
of the sort of immune
Not,
system
well, I went to the
injections.
Breakspear clinic, which is in Hemel,
Mm.
but it was going to cost me 3,000 just to have all the testings done first.
Yeah, yeah,
So,
yeah.
so I just,
Yeah.
I've spent so many thousands on ME
Yes.
over the years that I just
Yes.
thought I haven't got 3,000 to spend
Yeah,
to,
yeah,
you know.
yeah. I'm sorry, I haven't got very much
No,
to,
no, that's-
to
yeah,
add,
yeah,
and,
yeah.
and I'm sure you've become a sort of expert.
I have to be quite honest, that's
on it.
running
You know
away
far
from
more about
everybody
it than
that wears
your
any,
doctor.
yeah.
Yeah.
So any other questions from the floor? Yes, come on, sir.
You mentioned earlier that work's being done with medical students in the Royal College of General Practitioners to make them more aware of the ME chronic fatigue. Is there any work being done with practicing hospital doctors to make them aware of the symptoms and the problems people suffer?
I'm afraid that the hospital doctors has come a little bit lower down the list because it's more difficult, as it were, to sort of grab. There is something called, as you were probably aware, the Royal College of Physicians, which looks after hospital consultants and physicians in hospital. And I think this is partly due to the fact that our approaches to the Royal College of Physicians have been far less amicable than our approaches to other bodies within the health service professions. So although occasionally I will go around and do a hospital lecture, and it's generally fairly well attended, we haven't had quite the degree of input and success with hospital doctors as opposed to our current work with general practitioners, paediatricians in particular, social workers, medical students. I think this, it partly also stems from the fact that as I know, many physicians are still very sceptical disinterested.
It's difficult being in hospital as a patient for something else, like a new knee. When you've got ME, they don't want to look at that.
No.
I'm sorry, I'm trying to keep it generic, but
and of course this trickles down to the fact that we've got very few consultant physicians in hospital-based clinics seeing people with this illness and taking a real interest in it. I mean, we're talking to various people before the meeting started about the situation around here. So my understanding is there's no real service now in St Albans, although there was some sort of service. And I meet quite frequently with I think she's a wonderful lady at the Royal Free Hospital. She's not attached to the biobank, but she's at the Royal Free Hospital. I mean, her main consultancy is in infectious diseases and HIV. She's one of the HIV/AIDS.
Is that Dr. Murphy?
That's Dr. Murphy, yes. And now poor Gabrielle is now seeing almost half of London that wants a referral, because there's now so few physicians on the NHS in London at a specialist level who are up to speed with diagnosis and sensible management of this condition.
Okay.
So I'll tell you what, I'll just bring in the first question on the written.
Let's just deal with
Okay,
two
yeah.
days and make sure. You had a turn.
So I'm going to throw something else in now. You mentioned with fibromyalgia and things often after a road traffic accident. What, with your research, what do you think about others who are people like Raymond Perrin who are looking at the body structure and in terms of TMJ, bad necks, bad backs with the dorsal root ganglions, and that actually that they're feeling that it's a structure that is not enabling the body to function properly. And are you working with these people?
Well, that's a very good question, because it sort of takes us in all kinds of directions. Because I don't know whether you slightly linked to it. I haven't had time to read it, but it was flagged up to me yesterday. There was a piece in the Daily Mail online, apparently, New Hope for ME Sufferers. And it was about a lady, I don't know where she's been, but she was being treated successfully with a combination of human growth hormone, heparin, which is an anticoagulant, and high doses of antibiotics. And as you mentioned, we have Jennifer Bray, who I know very well because I went round the country with Jen when she was here with Unrest, who has now got this diagnosis of craniocervical instability. In other words, well, she said she's had the neurosurgery to correct this, what is supposed to be a defect at the back of the neck in the spine there, spinal area there, with quite complex neurosurgery, and is claiming and saying that that has had a significant effect on her state of health, a significant degree of improvement. So we now have, and I was in contact with someone last week, we now have a situation in there where people, the neurosurgeons in the UK will not touch this as far as I can see with the barge pole at the moment. We now have people raising money to go to neurosurgery in Spain to have this complex neurosurgery done at a cost of round about, I think it's £100,000. And as someone, as I say, last week was trying to raise £100,000, I think it was, to go off to Spain for this. And then we have I know Raymond Perrin very well, but I have to say I don't agree with his theory on causation, which is essentially the fact that there are toxins going around the lymphatic system and these can be removed by his form of osteopathy. I'm not convinced by that as a scientific explanation. So there again, there are significant number of people who are going off and having this form of osteopathy.
You're all working together, that's
no, I mean, I was sort of bringing in these others to just illustrate this tremendously wide range of treatments that are out there if you want to go and spend vast amounts of money. And in my view at the moment, they are all very speculative, very expensive, very unproven, and some of them have the potential to cause real harm. I'm not saying that Raymond's lymphatic massage has potential to cause harm.